Hello, I'm Dr. Sharayu Mohite, fertility consultant. In our last videos, we learned about ovarian stimulation, then ovum pickup procedure and embryology workup. So once your embryo has been formed, depending on you have a day 3 cleavage stage embryo or day 5 blastocyst embryo, then the decision of embryo transfer is being taken. So there are two kinds of embryo transfer. One is fresh embryo transfer and one is frozen embryo transfer. So fresh embryo transfer is somewhere once the pickup is done, as soon as your embryos are formed, on that day we do embryo transfer. That is nothing but a fresh embryo transfer. So decision of this fresh and frozen embryo transfer is always discussed with the client when we start with the stimulation. And there are certain criteria that on the day of trigger we do your hormonal levels. We see that there is no pathological endometrium, there is no associated uterine pathology. Then we can go ahead with fresh embryo transfer. If that is not possible, then we go for frozen embryo transfer. This frozen embryo transfer means once the embryo has been formed after ovum pickup, those embryos we cryopreserve, vitrified at the temperature of -196 degree in liquid nitrogen. And the next month cycle been observed that how your endometrium is formed. So we do a mock cycle in the next cycle after ovum pickup, where we analyze how your endometrium is being formed. We do mock embryo transfer. It's like your prelim exam, where we come to know that what could be the factors on the day of embryo transfer which can be problematic. And we give vaginal probiotics, so there should not be any infection when we are actually doing the embryo transfer. And once this criteria has been fulfilled, then on next month, on day 2 or day 3 of your cycle, we analyze, we see that endometrium is thin, your ovaries are quiet, and then we start you on Proganova tablets depending on your BMI, depending on your endometrium developed in your mock trial cycle. And 10 to 12 days of this Proganova has been given. Once on the scan, your endometrium is nicely triple lined and it is more than 7.5 mm, we do your estrogen and progesterone level. When this progesterone level is less than 1 and estrogen is more than 100, then we put you on progesterone tablets and injection. And on that particular day, depending on whether you have cleavage stage embryo or whether you have blastocyst embryo, we tell you what time we are doing your embryo transfer. And then you have to follow whatever the prescriptions been given to you. And on the day of embryo transfer, generally anesthesia is not required and you have already undergone mock embryo transfer. So your anxiety on that day will be less, and we are sure that without anesthesia, this procedure can be done without any hassle. So we at every point we give a scientific information to the client about the prognosis and how we are going about the cycle. So this is how we do embryo transfer at our center. So you feel free to contact on the contact given below. Thank you.